All right, great. Well, we will, let's get started here. Welcome everyone. Thank you so much for joining this webinar. We were really glad to share this overview of a new data sharing agreement, the IZ Gateway Multi-Jurisdictional Vaccine Provider Jurisdictional Data Exchange Agreement, or the PJA. This is a really exciting development. The PJA is going to help facilitate federal agencies, including the VHA and other multi-jurisdictional providers, in sharing immunization data through the IZ Gateway to IIS. VHA has been a great partner, and we're really excited that the PJA is going to help them share data with IIS through the IZ Gateway. Again, it's going to help with other multi-jurisdictional providers as well, but in particular, we're really excited about the opportunity here with VHA. The PJA is an essential component for any IIS looking to exchange data with VHA. And just, it's kind of exciting news. VHA in a few states have already signed the PJA, and we're looking forward to more states and jurisdictions signing on as well. So that is kind of what we're going to cover today, right? And then throughout the presentation, we will stop at a few points, a few kind of transition points for questions, and then we'll certainly have a kind of Q&A period at the end of the presentation. So before I go any further, though, I do want to pause. We have a colleague on from VHA, Yasmin, and I would just want to turn it over to her quickly for some intro remarks.
Yeah, absolutely. Thank you, Kory. Good morning, everyone. My name is Yasmin Daoud, and working alongside Dr. Pam Belperio and Tim Wong to support the VA business team in this project. On behalf of the VA, we'd like to thank you all for the time, efforts, and opportunity to work with you all, and look forward to the next steps. To date, the VA has signed the agreement, and the VA development team has already started work, which is currently underway. I also wanted to add that this project is a huge high priority for the VA secretary, so we are very excited. And again, thank you all for being here today. Back to you, Kory.
Great, thank you so much. And again, thank you guys for your partnership. We're really excited about this work, and appreciate all your efforts as well to keep this moving. So
Absolutely.
Great. I will just run through the agenda quick. And then we'll dive in, right? So the purpose of today, right? We're going to provide a review of information needed by parties to support the execution of the PJA. And again, that's the kind of agreement that's required to exchange with the Department of Veterans Affairs and other multi-jurisdictional providers. So to do that, right, we're going to give a quick overview of the IZ Gateway and its use cases, talk through some of the security consideration and jurisdictional controls over how data flows. We'll talk about the legal framework that supports the IZ Gateway, and then we'll do a deep dive on the PJA, and then we will do the Q&A. And again, if you have questions as we're going, please feel free to put those in the chat, and we will stop at various points to try to answer them. And if we don't get to them then, we will cover them at the end during the Q&A. So, you can take a look at these as we go, but these are kind of our speaker bios. So we're going to have, I'll be kind of representing talking through some of the programmatic stuff for the IZ Gateway conversation today, and then Chris from MPHL will be doing the kind of deep dive on the legal support. And MPHL is a great partner who provides the legal support and guidance to the IZ Gateway team. So again, the slides will be available. You can kind of peruse the bios at that point. We are going to keep marching forward. So just to kind of give a quick overview of the IZ Gateway, so we're kind of all level set on what it is and what it does, right? The IZ Gateway is really a cloud-based message routing service for immunization data exchange. It offers a consolidated integration hub for data exchange with standard onboarding and testing processes. Of note for this group, the policy framework is really important, right? Because the kind of policy framework of the IZ Gateway enables information data exchange through the IZ Gateway with a variety of partners, including federal agencies. So we will keep going. And I think one of the really important things to keep in mind, right? The IZ Gateway is a message router. It's about enabling more complete patient immunization histories, getting to IIS and providers and consumers. The IZ Gateway does not store data. It really kind of acts as a message repository only, and it's not the IZ Gateway today does not send data to CDC repositories either. So now we are going to kind of touch on the use cases that the IZ Gateway supports today. So the first use case that it supports is data exchange with vaccine providers. And that's really going to be the kind of use case we focus on today, and it's kind of relevant to the agreement that we're talking through today. There are other IZ Gateway supported use cases as well. So our second use case that's supported is IIS to IIS exchange. And the third use case that is supported is data exchange with patient portals and patients. So let's keep going. So this is the data flow diagram that depicts exchange amongst the parties. So, you know, if you kind of start on the left-hand side here, right, with multi-jurisdictional vaccine providers, the data flows to the IZ Gateway and then to the IIS, which is the final destination. The IZ Gateway software is cloud hosted by the Association of Public Health Laboratories, or APHL, and APHL hosts this on behalf of the CDC. And, you know, again, the double-sided arrows, right, are to represent, you know, the VXUs or vaccine reporting messages. And, you know, there are kind of the acknowledgement messages that happen with that as well. And there are it also serves to represent a QBP or a query for vaccine history. Again, that kind of has a response, and that's why it's the two-way. And the other thing of note, right, and as you kind of see on the right-hand side of the screen, this kind of depicts existing connectivity that IIS have, and the IZ Gateway is not, you know, does not aim to replace those kind of existing functional relationships and connectivity. All right. So a couple things I want to highlight for the kind of exchange with vaccine providers use case. So first, as you kind of think about the policy framework for this, right, the first thing that has to happen is the APHL data use agreement has to be signed, and most jurisdictions have already done that. Next is the multi-jurisdictional vaccine provider IIS data exchange agreement, or again, it's the kind of PJA, right, which is the main topic of this conversation today. That's another key element of the policy framework that has to be signed. And again, this use case allows for vaccine administration information and vaccine history queries to be sent to IIS from vaccine providers. You know, just going to briefly touch on this, right, some of the policy requirements for IIS to IIS data exchange. And, you know, again, this is the kind of IIS being able to exchange with their peers. And to do this, the other kind of component, right, is they have to sign the interjurisdictional MOU and kind of address the shared task order on the APHL DUA. You know, one of the kind of core elements of this policy framework for this is really the jurisdictions, the IIS, are in the driver's seat of which of these use cases they participate in. So the DUA kind of outlines that and allows IIS to say, hey, I want to participate in use case 1, but not use case 2, or, you know, however a kind of jurisdiction wants to do that. All right. And, you know, the kind of other piece here, right, for consumer access, again, they have to sign the APHL DUA and the access task order within that to enable the policy framework for consumer access. So we'll run through some of the kind of security considerations, right? So one of the keys here is that IIS have control of how they interact with data exchange partners through the IZ Gateway. They choose the use cases in which they will participate and which partners they will exchange with. You know, through the IZ Gateway, you have to set up and enroll data exchange partners in order to receive data. And again, you know, the kind of big point here, right, is that jurisdictions, IIS, will not receive data without prior consent and work to test the exchange to ensure it meets your data quality standards. Similarly, data is encrypted while in transit, and neither APHL, which hosts the IZ Gateway, nor the IZ Gateway itself collect or maintain PII. The IZ Gateway conforms with all the policy framework security standards included in the agreements signed by data exchange partners, like the DUA, the MOU, and the PJA. So at this point, I'm going to hand it off to Chris to discuss the legal framework and get into the details of the PJA.
Great, thank you, Kory. That was really a great setup to go into. Now we're going to talk about the legal, how all the legal agreements are in place to protect all of this data sharing. So next slide. It all begins in the center with the IZ Gateway, right? Which Kory mentioned. It's a platform that is hosted by the American Public Health Laboratories. The CDC is actually sponsoring it. And this is the place through which all the data will pass. Next slide. And the parties to these various agreements are represented on the right there. Those three orbs represent the states and the various jurisdictions, a total of up to 64 jurisdictions. And then on the left, the parties represented there are the multi-jurisdiction vaccination providers. The top orb represents the various federal agencies like the Veterans Health Administration or the Department of Defense. And the orb below it is the more non-traditional vaccinators, whether they're skilled nursing facilities or long-term care facilities. So those are the parties. Now the next slide shows the overlay of all of the various legal agreements. So take a deep breath, here we go. The agreement, let's start on the right there. The agreement on the right, the green square, yes, the memorandum of understanding, that is the agreement that the IISs each sign in order to be able to exchange data with one another through Gateway. Then if you go counterclockwise down the bottom there, the data use agreement, the American Public Health Laboratories data use agreement, which is the baseline for all of the exchanges happening here. That's the agreement that each of the immunization information systems need to sign with the APHL in order to engage and use the services having their data flow through IZ Gateway. Now on the left side, depending on whether it's a federal agency or it is one of those other non-federal agency providers, determines what type of agreement they have to engage with the IZ Gateway. Because the CDC is sponsoring this, all those federal agencies will be signing a memorandum of agreement. That's what the VA has already signed with the CDC to engage those services. The non-traditional vaccinators, SNFs, LTCs, those will be signing business associate agreements. If, you know, in the case of the use case where their providers are providing to the IISs, because they're basically dealing with the data of the covered entities on the right, those IISs, so they'll be signing a business associate agreement in order to engage in that data. And then what we're primarily talking about today is the top agreement there. Thank you, Kory. The provider jurisdiction agreement. And this is, as you know, the existing state is that for any federal agencies to share vaccination data with any of those 64 individual immunization information systems, they need to sign, you know, an agreement with each one of them. So what we're driving for, and the purpose of this provider jurisdiction agreement, is so that those multi-state, multi-jurisdiction providers can actually just sign this one agreement, the PJA, rather than 64 separate ones with all those different jurisdictions. So our hope is that it will save everyone a lot of work all the way around. Okay, next slide, please. So let's go ahead and do a little bit, because that data use agreement really is the baseline for all of these exchanges happening. Let's just kind of do a quick run over of this. And most jurisdictions have actually, most IISs of jurisdictions have already signed this. So that data use agreement, which again was that agreement on the bottom between the IISs and the gateway or the APHL, it's required for participation in all use cases. The purpose is to facilitate the exchange of immunization information through the gateway. The security is compliant with FSMA, Hipaa, FedRAMP. And then it's the task order attached to the DUA that allows the jurisdictions to select, you know, the use cases or the project components that each jurisdiction wishes to engage in. I do want to mention that I want to reemphasize that the IIS signed the DUA with APHL, and then will utilize the PJA, the agreement we're talking about today, the multi-state jurisdiction, the multi-jurisdiction provider agreement, with federal agencies and provider organizations. Okay, next slide. Okay, so going back, this is just to reference again, what we're talking about is the agreement today is the one on the top there, the provider jurisdiction agreement, or we call it PJA, because if I have to say it 7 more times, it's going to get completely jumbled. Next slide. Okay, let's go ahead and do the deep dive. So this is the deeper dive into that provider jurisdiction, or the PJA. So this is the task for this was to come up with a multi-party agreement that ideally most parties can sign on to spare the, as I mentioned before, 64 separate agreements to be able to share data back and forth with each IIS. So it was modeled after the interjurisdictional MOU, which again, recall that most jurisdictions have already signed the MOU and are participating in exchanging with other IISs. We reviewed 15 of the 15 jurisdictions IIS related agreements to learn from those and to model on those and see what issues there were. This is, we solicited feedback. We sent it out to the IISs and solicited feedback on it and got feedback, and that made for a better agreement, what you see in the current form. And as mentioned by Yasmin earlier, the VA is already utilizing this. They have signed on, some states have signed on, and they're not utilizing in the sense of sharing data yet, but they're on board. It's, you know, in the process of getting ready to go. And hopefully soon that sharing will start. Our hope is that other federal agencies and provider organizations will also utilize this agreement, again, just to minimize the administrative burden across the board for everyone involved. Next slide. So now we're going to go ahead and go through some of the particular terms of it. We anticipate that these are some of the basic questions that people may have. But if you've got other questions, we'll handle them certainly either through the Q&A or the question format, or at the end when we do question and answer. So the parties to the PJA are the IISs on the right side of that chart and the multi-jurisdictional vaccine providers that you saw on the left side of the diagram that we had. And the purpose are exactly, you know, data exchange of immunization information through the IZ gateway. It's not a data clear, it's not a data pool or anything. It's just going through, and specifically immunization reporting and immunization query consistent with applicable law. Next. It does not, importantly, this agreement does not prevent other communications or agreements outside of the IZ gateway in terms of who else you can share, each IIS can share their data with. And the applicable law is just straightforward here. It's all applicable statutes and regulations of the state or the jurisdiction, including the federally recognized tribal governments and US territories in which the party operates, as well as all the applicable federal statutes, regulations, and such. And federal entities are subject to applicable federal laws only. We'll point that out. Okay, next slide. So this IZ Gateway supports 2 types of data exchange, you know, the push and the pull. So it supports the immunization reporting through the VXU messaging, where the provider immunization, the information is provided, pushed through IZ Gateway to a jurisdiction, and then also immunization queries, QBP messaging, where the provider is querying one or more jurisdictions through the gateway, and one or more jurisdictions report back or, you know, provide back immunization information to the querying provider. And each party, again, through the various legal agreements, each party determines the information it provides to another party. Next slide. Okay. Again, it's more straightforward. The immunization information specifically means immunization or information that's created by a provider or created within or received by an IIS that relates to past, present, or future immunization status. It also includes provision of vaccines to an individual and medical or clinical information that's related to the immunization. Important to note that yes, the receiving party, consistent with their applicable law, may incorporate the data received from queries into its data system. And again, data is subject to control, use, and disclosure. Data is subject to the receiving party's control, use, and disclosure. And it's the receiving party that's responsible, obviously, for data protection. The sender obviously has its own obligations to keep data safe. Next slide. Privacy and security, key factors to be thinking of, or that worth considered, I should say, in the drafting of this, is that by signing, the parties are affirming that they have implemented confidentiality policies, that they have implemented appropriate administrative, physical, and technical safeguards to protect privacy and security, that they're taking all reasonable efforts to implement industry standards around security. It says that Hipaa is the floor for providers, and federal agencies must comply with applicable law. There's also an additional, notification about breach in there, and that is that, and there was some discussion back and forth. Some of the feedback we got asked for, I would say, more rigid breach notification requirements, possibly even with a timeline to it. But we felt that given the whole structure, the whole legal structure of all of this and obligations that parties already have for notification of breach, that this was a fair suggestion to make, that, or a fair, the appropriate clause to put in here, that upon discovery, a receiving party makes reasonable efforts to identify the source of the data received, and then notify the sending party and administrator when they suspect a breach or they know a breach has happened. Okay, next slide. This is kind of the smorgasbord of basic boilerplate language you would kind of come to expect or look for. Governing law is stated there. Their withdrawal and termination clause is written in there. There is no monetary exchange happening through this agreement. There are no warranties on either party in the agreement, per the agreement. The limitation of liability, the partners are responsible for their own liability. There is no indemnification through the contract. And the period of the agreement of the contract is that there is no fixed term. Parties pursuant to the withdrawal and termination clause can cease to participate in this agreement at the time, again, in sync with the requirements of the withdrawal and termination. Next slide. Also note that because this is not a traditional, two-party agreement, there are multiple parties to this agreement, there needed to be an administrator of this agreement. So the CDC is the administrator agreement for this. There is the administrator responsibilities these are just some of the administrator responsibilities, that the CDC must maintain signed copies from all signatories. They have to make a list accessible of all the parties to the PJA so that IISs or the federal agencies or non-traditional providers, on the left side of the graphic we always refer to, either any party to the agreement will be able to see a list of who else is a party to the agreement at the time. So the CDC is obligated to maintain that. The CDC will also be responsible as administrator for receiving and providing any notices under the PJA and maintaining contact information on those, where notice goes to, that's on them also, as well as facilitating addressing any questions or concerns that arise under the agreement. Next slide. So with that, I think that's pretty much all that we wanted to cover for you today to go through the legal issues. At this point, we are open to Kory. Well, I guess we'll go back to you, Kory, to moderate whatever questions we've gotten.
Yeah, great.
Thank you.
Yeah, thank you, Chris. That was great. So at this point, let's open it up for questions. I see we've got a couple in the Q&A, so let's start digging in. So the first question is, can an IIS choose which federal agencies it shares information with, or is it all or nothing? Chris, maybe I'll toss that over to you.
Sure. Yes, they'll be able to choose that. As of now, yeah, so that's the short answer. Yes. Carrie, do you want to extrapolate on that, or was that the $64,000 answer?
Yeah, I think that's the short answer. There's onboarding and technical testing and requirements that you'll go through with each, whether it's another jurisdiction or each provider that you onboard. And so you're able to choose the entities you exchange data with. So just because you sign the PJA, it doesn't automatically open the floodgates that you have to share with everyone.
Great. And I think this next question is on a similar vein. So how do you handle an opt-out jurisdiction? This is a receiving jurisdiction under the PJA if there is no indication that the VR from the sending jurisdiction has been given the opportunity to opt out?
I understand the concept of the question, but could you just say it again so I understand the flow that they're talking about?
Sure.
Can I read?
Yeah, I'll read it again. How do you handle an opt-out jurisdiction, so the receiving jurisdiction, under the PJA if there is no indication that the VR from the sending jurisdiction has been given the opportunity to opt out?
That's more of a technical question. I'll take a shot at it, just knowing that there are various, digital certificates and such, that there's a technical, if the question is around the technical stuff, that no party will be able to receive data if they have not signed all the appropriate agreements, and even if the sending source is not aware whether or not the receiving end has, if the jurisdiction that's pinging for information is aware or is not aware of whether or not the IIS on the other side is not participating or has opted out, they're just not going to get information. So I don't know if that's the direction. I'm not quite sure if I understand the direction of the flow, but
Yeah, and I don't know, Kelly Gully, would you have anything to add on that? Or do you think that covers it?
I think that does cover it. I think that the previous question really gets at the heart of what Elizabeth Maynard is asking, in that jurisdictions, if they have opt-out clauses, then they can choose to participate or not participate in that realm. So I think you guys covered it pretty well.
Okay, great, thank you, Kelly.
Can I actually, before we move on, can I just add to that a little bit? And I should say I didn't introduce myself for everybody on the call. I'm Carrie Waggoner, and I work with Chris at the Network for Public Health Law. So just before I want to point out some language in the PJA around data exchange, and where there's some language in the section that describes the immunization reporting, so that VXU message that a jurisdiction would receive from a provider organization. And if you're in the same jurisdiction, so the provider and the IIS in the same jurisdiction, there's language in here where the provider affirms they will obtain consent or any necessary opt-outs as needed. So if that law applies to them, whatever jurisdiction they're in, they would need to follow the law of that jurisdiction in terms of obtaining consent to send the information to the IIS. And so that will depend on who the party is and what law applies to them. So for example, like a federal agency may be located in another state or just subject to federal law. So it depends, but if you're in the same jurisdiction, generally providers have to follow the law of that jurisdiction in terms of obtaining consent to collect and send the VXU information.
Great, thanks, Carrie. And if there's any follow-up on those, please add additional clarifying questions in the chat, and we can circle back if there's any more to dig in on that one. So great. Okay, the next question. So for multi-jurisdictional providers like Walgreens and CVS, with this IZ gateway connection in place, will the state IIS be able to retrieve all shots they've given? We have some patients who are missing doses on their records, and when they reach out directly to the stores, they tell them they cannot submit that data to us. Well, so I guess I'll maybe take a first shot, and then maybe we'll see if Kelly Gully has anything she wants to add. Right, I think a really important thing to keep in mind here, right, is that organizations have to onboard to the IZ Gateway to be submitting information through the IZ Gateway, right? And the kind of the national pharmacy chains are not participating today, so this wouldn't really be relevant today. If they joined in the future, certainly would be something you get access to the data. But today they are not participating. So hopefully that helps clarify. But Kelly, anything you'd want to add to that?
Oh, that was a great answer.
All right, let's keep going. All right, here's a hot topic. Do you consider IIS a covered entity under the HIPAA privacy rules?
Carrie, you have a more succinct answer than I do, I'm sure.
So I would say the short answer is, in general, no. We recognize most state health departments are hybrid entities, and that typically immunization registries are carved out as a HIPAA, as a non-HIPAA covered function. That said, there are some health departments that are fully HIPAA covered, and if that's the case, there have been instances that where, in addition to that data use agreement with APHL, those baseline agreements, APHL will execute a business associate agreement with the jurisdiction, where then, just similar to the way it flows with providers that are HIPAA covered, APHL would be acting as a business associate of the jurisdiction if your immunization information is considered HIPAA covered.
And I'm just going to jump to I'm going to skip a question because this next one's about HIPAA again. We might as well stay on the same theme, right? So I think the question is, are all multi-jurisdictional providers covered by HIPAA? So could there be multi-jurisdictional providers that participate in the IZ Gateway that are not covered by HIPAA?
So in general, most providers should be covered by HIPAA. And I say in general just because there could be some nuance with the federal agencies. Federal agencies under the PJA are subject to applicable federal law. So if a federal agency is subject, to HIPAA, that's a federal law, they'd be considered a HIPAA covered provider. But they're also subject to other federal privacy laws. So there could be some small cases where there's a bit of nuance there, but in general, most providers, so those non-traditional private providers, and then some even of the federal providers, are subject to HIPAA.
Great, thank you, Carrie. The next question is, where can you get a recording of the webinar? So the recording and the slides will all be, well, I suppose the previous ones are already posted on the NPHL website, and future ones will go up on there as well. So the materials are on there. So great question. All right, I think that's everything. Oh, well, no, just got another. Do you have a rough idea of when VHA would start sharing data? Great question. Kelly Gully, do you know the answer to that one?
We are actively beginning testing with 1 or 2 jurisdictions right now. And so as soon as we can get everything up and running and connected, we hope in the next couple months, as soon as we can.
That's right. We're all committed to moving this as fast as possible. So great. Thank you, Kelly. And I see there are a couple questions in the chat as well. So if a jurisdiction is one of the 64 that has signed an agreement with the IZ Gateway, is there still a requirement to sign the PJA? You want to take that, Chris, or Carrie?
Yeah, I'm looking for the answer. I do better if I can read it. Is it in the Q&A or is it in the chat?
It's in the chat.
Carrie,
And
if you
Kory,
can do
it might be helpful, sure, to go back to the legal framework.
Yeah, absolutely.
Yeah.
Yeah, it depends, right? It's always the answer.
Well, I think and so Catherine, correct me if I'm not getting this right, because I'm making an assumption and answering your question. But I think what you're asking is if a jurisdiction has signed the APHL DUA, that baseline agreement, are they still required to sign the PJA? And so the answer is yes, because the APHL DUA, okay, thank you, confirmed I had it correctly. The APHL DUA is that baseline agreement for jurisdictions to onboard to exchange any data under any of the use cases through the IZ gateway. So it's required regardless of the data exchange use case you want to participate in. So for example, with vaccine provider exchange, you'd need to sign the APHL DUA and the task order associated with the DUA, and then the PJA. And just to kind of further it from there, if you wanted to participate in the jurisdiction to jurisdiction data exchange, then you'd sign the APHL DUA and also the interjurisdictional MOU.
And I'll just
So
add
there are,
one other.
depending on the use case, there are different agreements that you may be required to sign.
Yeah, and just adding another layer to that, if your question was, can you participate, continue to the use case of sharing information through the IZ gateway, just exchanging it between IIS to IIS, but you don't want to have the other exchange with the federal agencies, then no, you don't have to sign the PJA for that, but you do have to sign the DUA for the regular exchange of data through the, with the IISs.
Great. And we may have already touched on this, but it doesn't hurt to revisit this. So there, again, a kind of a question back to those states where there are consent requirements related to IIS reporting. So the question is thinking about the kind of aspect of individual opt-out, right? So if an IIS registrant later withdraws their consent, how does that work within this framework? I think I'm getting that right. So please correct me if I'm wrong, Rachel, but I believe that is the nature of the question.
I'm trying to clarify when they're talking about, and Carrie, again, let's double team this. When I think of consent, I think of an individual having consent, not the IIS with consent. So is the question, maybe the person can clarify,
I think it's about the individual. Yeah. So it'd be like an individual, opts out after later, right? So some of their data flows over the IZ gateway, then they later opt out. What is that? What does that mean? I think it's my interpretation of the question.
Again, Carrie, you've done more with this. I mean, obviously anybody who it's the obligation of, general HIPAA rules, right? It's the obligation of whoever is receiving that data from the individual, or whoever has the obligation for getting the consent of the patient, per their privacy agreement. It's up to them to inform the system, to put the information in the system that data is no longer available. How that happens is a technical thing I don't know, but Carrie, do you want to, anything to add to that on the legal side?
I think you've covered it generally. If the IIS, say, has responded to a provider query and later the individual withdraws their consent, I think in general, I think the IIS would follow their normal process. And my understanding is that typically does not involve clawing back data that might have been shared appropriately when consent was in place. It would just mean typically, I think that the IIS would not continue to share data now that the consent has been revoked. But if anybody has concerns about that kind of on an individual basis, I think that's a more case-by-case nuanced question, and that's something, if it is a concern for any of the jurisdictions, we'd be happy to kind of talk through and think through how that would work from a legal standpoint. And then I think there may be other technical aspects to consider as well.
Perfect. And there was another question in the chat just about the link to the recording. And so that is, or in the Q&A, there was a question about that. The link is in the chat now. So you should be able to get it on there. Any other questions? I don't see any other live questions. Let's give folks a minute to see if there's anything else that pops in here. All right, while we're waiting to see if any last questions come in, I will kind of run through the next steps. And again, if there are other questions that come in, we still have a little over 15 minutes, so we can definitely tackle more. I think there's been a great conversation, lots of great questions. First, obviously, thank you everyone for attending. We're again, this is a really exciting step. We're excited about the PGA. We hope this has answered your questions. Obviously, if you have others, please send questions or requests for any individual discussions or kind of additional questions you want to dig into to izgateway@cdc.gov. We do have a short survey after this. We've got this is a series of webinars, so we're always looking to kind of refine and improve it. So if you have any feedback on it, it's super helpful to us, and we'll use that to kind of refine the webinar series as we go forward. You can see the dates of the next 3 webinars that we're going to be holding. So if you have colleagues that want to attend, or if you just want to hear it all again, the kind of next 3 dates are on here. So, again, really excited about this. Looking forward to folks signing, and I'll just double check to see if we have any last questions. Okay. I think we're all set. So again, thank you everyone. Really appreciate your time today. And again, if you have any questions or other things we can do to help kind of, move things forward with the PGA, please submit those questions. And thank you all.